Good afternoon, everyone. My name is Perla Martinez. I am the Diversity, Equity, and Inclusion Administrator for the Office of Diversity, Equity, and Inclusion at the Franklin County Board of Commissioners. I want to welcome everyone to today's Lunch and Learn to celebrate in honor of Breast Cancer Awareness Month. I will give you a few remarks about it, and then I will turn it over to our presenter for today. As some of you may know, for nearly 4 decades now, this country has recognized October as National Breast Cancer Awareness Month. It is a time annually devoted to educating everyone about breast cancer and the importance of early detection and access to timely, high-quality care. Because no matter who you are or where you live, breast cancer may touch your life. It is necessary to understand the warning signs of breast cancer, your risk of breast cancer, and what's normal for you so you can take action if there are any changes in your breast or underarm areas. In this Lunch and Learn in particular, we will highlight the inequities in breast cancer treatments for under-resourced communities across the country, as well as the inequity in treatment between Black and white women and how that affects their outcomes when it comes to breast cancer. For today's Lunch and Learn, I am joined by Chasity Washington, who is the Senior Director for the Cancer for Center Health Equity at the Ohio State University Comprehensive Cancer Center. So welcome, Chasity.
Thank you. Good afternoon. Pleasure to be here to share with you today a little bit about breast cancer, breast health, and the inequities that some of our women experience. And then I'll have a few resources that we will share as well with the audience. So I'm going to share my screen. Let's see. All right. So again, my name is Chasity Washington. I am the Senior Director with the Center for Cancer Health Equity. We do a lot of outreach and engagement around all sorts of cancer. And our breast cancer awareness program is called Turning the Page on Breast Cancer. And this is the image that we use in some of our materials that was done by Janie McGee, who's an African-American artist. So some of the things that we're going to cover today: what actually is breast cancer? What are some of the risk factors and things you can do to lower your risk? Again, a little bit about breast health disparities, and then how we can improve those outcomes when it comes to breast cancer. So breast cancer, like any cancer, is basically when your cells in that area of the body, so for instance, this would be cells in your breast area, grow out of control. So your breast cells or any cell has a job to do. As it gets old or has a genetic mutation or other things, they usually will die. And then new cells will grow. What happens in the case of cancer is the cancer cells have this mutation and then they don't die. They continue to grow and make tumors. And that's when the problems occur and you end up with a cancer. There's different types of breast cancer. The main two types are what is called invasive ductal carcinoma. So again, it just references where the cancer starts. So for in this instance, it starts in the ducts that are usually where the mammary glands are. And then it can spread outside of that into other areas of the breast or chest. And the same thing with the lobular carcinoma. Those usually starts in the lobes. And that again can also spread to other areas. And we'll talk a little bit about staging later, but we want to make sure if we do have a breast cancer that we find it early where it's still in that breast and chest area and hasn't spread to another part of the body. So how common is breast cancer? So about 1 in 8 women will be diagnosed with breast cancer in their lifetime. So about every 3 minutes, someone in the US will be diagnosed with breast cancer. Men also get breast cancer, so about 1% of breast cancers are found in men. We actually know that Beyonce Knowles' father was diagnosed with breast cancer. So again, men can get breast cancer too. If you see anything abnormal in your chest area, definitely recommend getting that checked. So there are disparities in breast cancer. In particular, Black and Hispanic women are diagnosed with breast cancer at younger ages. They tend to have more aggressive cancers. They also usually present with later stage disease. And then African-American women in particular are 41% more likely to die from breast cancer than their white counterparts. And this is due to a lot of things. So some of those are due to implicit, explicit bias. These individuals sometimes have no insurance or are underinsured, and we know that affects the kind of treatment that people are able to get. It also affects whether or not they will go in for services. Again, healthcare is expensive. If you don't have insurance, you are not going to go and get the mammogram. You're not going to go back if you have an abnormal mammogram, if your out-of-pocket expensive is expensive, and things of that nature. We also get something that's called triple negative breast cancer, and that is a more aggressive type of breast cancer. African-American women, Hispanic Latinos, and Ashkenazi Jewish women get this disease. It can happen in between breast cancer exams or mammograms. And then it also is harder to treat. That's what the negative comes from, is that it's negative to different types of receptors, which means there's the current treatments that we usually use are not always effective in this cancer. So that's some of the reasons behind why we have a worse outcome when it comes to breast cancer. And there's also other disparities. So women in rural spaces don't have mammography facilities sometimes, so they do not get mammograms, or they have to travel to places like OSU or Ohio Health hours away in order to get those services. So what puts you at risk for being diagnosed with breast cancer? Being a female, because we have more breast tissue. The older you get, the more likely you are to get breast cancer. Certain genetic mutations. So in cancer, about 10% of any cancer is going to be attributed to genetics, which means the rest of the cancers are going to just be because of random genetic mutations that occur over time. So again, people like to say, well, I don't have cancer in my family, it doesn't run in my family, so I don't have to worry about it. But 90% of the time, you will probably be that first person in your family to be diagnosed with cancer, because not all cancers are genetic. If you do have a family history that maybe is not related to a gene, that also increases your risk. And then I've highlighted having high density breast on your mammogram. So a lot of African-American women, a lot of women under 50 have what's called dense breasts, and that just makes it harder to visualize cancer early in the mammogram. Oh, and I must have these on a timer, sorry. So again, if you have a personal history of other types of cancers, that can increase it. Having your first child after 35, or having an early start of your menstrual cycle, which again, that just gives you a longer exposure to estrogen and other hormones, which can feed breast cancer and increase your risk for breast cancer. And then other things like alcohol intake and obesity. So there is no way technically to prevent breast cancer, but again, you can do some things to mitigate those risks that we talked about on the previous slide. So exercise, physical activity, limiting your intake of alcohol, doing your mammogram. So again, screening is the way to look for cancer before you have any symptoms, before you can feel the lump in your chest. That's what we want. We want to find it early where it's still inside that breast space. Because when it's found early, then we have a better chance of treating it and also having better outcomes. So not just surviving, but thriving, not having other issues related to the treatment that can impact your day-to-day life. So survival rates from early detection. So this is why we really encourage women to get their mammograms every year. And then if there's an abnormal result, don't hesitate in coming back. So we see that a lot, especially in African-American women and other women. If they get an abnormal mammogram, they may delay coming back in for that diagnostic workup. And a lot of times it is normal, but then sometimes it's not. So again, if we find cancer early where it's inside the breast, still what we call a 0 or 1 stage, after 5 years, the chance of a woman still being alive is the same as if they hadn't had breast cancer. So the same as what the general population would be. If we find it in a stage 2 where it still hasn't spread very far, then that's about a 93% survival rate. And then after that, stage 3 and stage 4, we see those survival rates decrease. And what we don't want is a stage 4, because that means the cancer has spread outside of the breast for sure. Usually the common place that a breast cancer will spread will be the lung. And then sometimes you'll have what's called a bone metastasis. So there's still treatments available for the stage 3 and stage 4. But again, the goal is to to definitely detect these cancers earlier because we have a better chance of survival, and then also, tolerating the treatments and having less side effects from those. So what else can we do? We can know what's normal for you. So people have probably heard of breast self-exams. I always encourage women to know your breast, what's normal for you. If you see anything that's different, definitely get it checked out. So obviously a lump or a knot or thickening in the area of the breast, any changes in your nipple, if it starts pulling in, any new pain, any puckering or dimpling of the skin, definitely any discharge. And then if you get an itchy, scaly sore or rash, that can sometimes be what's called inflammatory breast cancer. So we definitely want to get that checked out. And then just like I said, anything that doesn't feel right to you, not even just when you're looking at your breast, anything in general when it comes to your health, if it doesn't feel right, if it doesn't sit right with you, definitely contact your doctor and get that checked out. So as we said, breast cancer screening or mammography is the most important tool we have against this disease and making sure that everyone survives. So a mammogram is just an image of the breast. This is what it looks like. It's a lot of gray. So when we talked about having that dense breast, so if you do have dense breast tissue, it will be more cloudy in there. It'd be harder to detect like a tumor that was in there. So this is not a dense breast in this image. But if it was, it would be like trying to find a snowball in a snowstorm. But we do have new ways of detecting breast cancer. So 3D mammograms or tomosynthesis, that takes a better image, more slices of the breast. And again, is 3D versus the 2D traditional image. And we can see better, especially in the women with those dense breasts, again, which are usually those under the age of 50. We can also do ultrasounds. We have what's called a automated breast ultrasound, which is also excellent for women who have breast tissue that's dense. And we have lobbied for coverage for that under insurance. But when it first came out, it was not something that was covered. So again, just making sure that you do go get your mammogram. If indicated, you may have to have one of those other tests, an MRI or an ultrasound. And then when you go to get your mammogram, people always say, oh, it's uncomfortable, it hurts, I don't want to get it. It doesn't take that long. We actually take a mobile unit out at 15 minutes on and off the bus to get your mammogram. We say for women who are still having menstrual cycles, don't get your mammogram during your period, because if you already have a lot of tenderness or sensitivity in your breast, it's probably not a good idea to schedule your mammogram around that time. And then just don't wear any perfumes or deodorants and powders that day. And then for easy access, if you don't want to totally undress, we recommend a top that you can take off so you don't have to, because those are some of the things we say, well, people don't want to, they don't want to have the pain, they don't want to have to get undressed, all these things. So these are just some tips that make it easier when you go in to get a mammogram. So again, we know that not everyone has insurance, and even in those who do have insurance, one of the barriers can be co-pays or deductibles. We are lucky here that we have the breast and cervical cancer early detection program. Every state has one, but ours has expanded. So now actually, I believe the income is at or below 400% of the poverty level. So we have more women that are able to enroll. It not only covers mammography, diagnostic testing, or any treatment that a woman would need. You can also do the same services for cervical cancer. And then if you're diagnosed, you get what's called BCCP Medicaid. So again, this is not only uninsured women now, they've opened it where insured women who maybe have high copays or deductibles can also enroll. And again, it's pretty easy. You can call that number. So here in Franklin County, we're in the central region. So it's facilitated out of Licking County Health Department. And that number is 1-866-418-4963. And they will walk you through the process to enroll, get you scheduled at a provider. If you don't have a physician, they will get you connected to a physician for a well woman visit, and then they will schedule your mammogram and PAPs and whatever else it is that you need to be scheduled. So we have a program called Turning the Page on Breast Cancer, and the website for that is inbreastcancerohio.org. And this program will actually allow you to do a personalized risk assessment. So if you scan the QR code or go to the website, you can take a risk assessment by answering about 7 to 10 questions, and it will then give you a personalized assessment. So are you at average risk? Are you at high risk? do we recommend that you speak to someone about genetic counseling? It will give you resources about where to get a mammogram, where to find a genetic counselor if you need one. You can also link to a patient navigator on the site or by calling 614-293-7020, and they can connect you to all sorts of resources, including where to get screened or primary care provider. They also deal with other issues that might be barriers like transportation. So it's a valuable resource. Again, the website is very Afrocentric. We do have artwork, stories from African-American survivors, and specific information that is tailored to African-American women on that site. We also include community events that are upcoming on that site. So you can feel free to share events. If you have breast cancer awareness events, we'll get them on the site. And then you can also go to just to see what's going on. And we do cover 13 counties in Ohio with this program, and Franklin County is one of them. So again, we just want to remind folks to know what's normal for you, make sure that you get screened, and then make those healthy lifestyle choices. We know that sometimes it's hard to eat right, exercise, and definitely reduce your stress level. That's another risk factor for African-American women. So stress or allostatic load can also impact your breast cancer risk and breast cancer outcomes. And so we want to make sure that we're finding ways to reduce our stress and provide more self-care for ourselves as women and everyone in general. So again, that was my quick overview of breast cancer and some breast health disparities. I will be willing to take questions at this time.
Hi, Chastity. Thank you so much for that presentation. I was wondering if we could touch a bit about the myths regarding breast cancer. I know those exist out there in order to, build more knowledge with women and men, just about what are some things that you have heard or that there are myths that are no longer true about breast cancer.
Right. So I think one of the ones that we've heard a lot is, like I said, I don't have breast cancers. Like, it doesn't run in my family, so I won't get it. That's not true. Like I said, most people are the first in their family to get cancer sometimes. We've also hear a lot about if I wear an underwire bra, it's going to cause breast cancer. So we have no evidence that underwire bras or deodorant at this time are significantly tied to breast cancer. Like, there's no proof that using underwire bras or deodorant cause breast cancer. We've heard things such as cell phones can cause breast cancer. Again, no evidence that would link cell phone usage directly to breast cancer. So again, those are some of the things that we commonly hear. Other things maybe about costs. So like genetic counseling is expensive. My insurance doesn't cover mammography, those kinds of things, or like there's nothing I can do. So we know that that's not true. Like I said, most of the things you do to be healthy in general, eat right, exercise, see your doctor on a regular basis, and then of course getting mammograms. But those are some of the main ones that we hear. Or that I don't want to lose my hair, and then you may or you may not, but that's not a 100% guarantee with treatment. And again, with some of the advancements, we're trying to eliminate people having to do chemotherapy and radiation when we can. There's things called targeted therapies, and we can do biomarker testing and find out specific makeup of people's tumors. And so sometimes you cannot have to have those procedures. Sometimes you just have surgery. It really just depends. And so what we say is every woman's journey is different. And it just depends on the type of cancer they have, the makeup of their tumor, as to what's available and what treatment they will have to go through.
Yeah, thank you for that. I'm glad that you brought some of those up because I have certainly heard some of those, and I have heard people, just kind of saying things like, oh, you shouldn't do this, or coffee can cause breast cancer, and if you drink a lot of coffee, this is what's going to happen. And I'm glad you touched on the fact that men can also get breast cancer, because it is a myth that sometimes that only women can develop breast cancer. And I know that you mentioned it yesterday, but I believe that some of the same ways that women would detect or have an inkling that something is not right would be the same way that men would, right? Is that correct?
Correct. So again, men do not have as much breast tissue as women, so we can't really do a mammogram on them. But they can definitely, if they feel something, if there's a lump or a bump in their chest and it's just not, normal, they don't definitely get that checked out. Usually for them though, what we will have to do is they'll have to do an ultrasound or MRI or something, because again, they can't have the mammogram like a woman can. But again, it's the same sort of thing, eat right, exercise, limit alcohol, definitely don't smoke, those sorts of things. And then, like I said, if they do feel a lump or bump in the chest, definitely come and get it checked out. For them, since it's not a mammogram, it would at that point be a diagnostic procedure. And we do actually have a diagnostic center at OSU, so they wouldn't necessarily have to go to the breast center. Sometimes men don't want to go to a breast center, so you can go to the diagnostic center and have some of those tests done as well.
I'm glad that option exists for men out there. That way we can like reduce some of that, not wanting to go do it just because it is at the breast center. Going back to the Turning the Page on Breast Cancer program, would you be able to give us a little bit of like background as how it got started? Or, we know a lot of the health disparities on health equity that exist out there. Is this something that was, researched and noticeable by OSU, and then they went and wanted to create this program? Just a little bit of background about it, please.
Right. So we originally wrote a grant, and it was funded by the American Cancer Society, and also the James also gave us some money. But we know that there was a disparity, and particularly in African American women. And like I said, that mortality disparity is huge, right? 41% more often that we die from breast cancer. So we thought about, well, what are the ways that we can help impact that? So in addition to the website, we actually go out and do education in the community at different events and provide women those resources, allow them to do the risk assessment and walk them through their results right there. There's also a portion of that where we work with providers, right? So we want to make sure that the providers are educated. So we have a CME for the federally qualified health centers or other physician clinics that want to participate, and we educate them on breast cancer, breast disparities, the latest updates. They get CME credit. And then we'll also work with them if they have barriers that they're aware of in their clinic to getting their women in for screening or a follow-up, and we will teach them how to implement evidence-based interventions. So, for example, we have one clinic where they get the women in, they get them screened, they can get diagnostics, but they were noticing a lot of them could probably benefit from genetic counseling, but they were having a barrier getting them in. So we worked with them to develop materials that they could give their patients that explain the benefits of genetic counseling. We gave them a direct link to a genetic counselor that would do counseling for their women at no cost. And then if they needed to do further follow-up, they could also bill insurance for other things, including testing. So we did do that. Some folks, it's that they can't get their women in for screening. So we actually have a mobile mammography unit that we take out all over Franklin County in Ohio. You may have seen it at someone's church, or we also pull up to the FQHCs because, again, some of our more vulnerable populations seek care there, but they don't want to come to the James or Ohio Health or somewhere else to get that screening. So if we pull the mobile unit up in front of where they already go for care, where their provider is, where it's trusted, where they're familiar, then they're more likely to come and get their mammogram done. So we've done that a lot with Heart of Ohio, Primary One here in Franklin County. We go several times a year, pull up in front of their different health centers and allow their patients and community members to come and get a mammogram right there in their neighborhood. They don't have to come here, they don't have to park, they don't have to do all those things that sometimes deter people from coming here or other healthcare institutions.
Yeah, I can imagine. And I'm glad that you are able to take those resources back into the community because, just like you mentioned, a lot of the reasons why, just from the fact that you may not want to just go get screened because there's probably already a risk factor that included, and just kind of not wanting to navigate the system in general, or the insurance process, or just all of that can be daunting. Plus, if you like the resources to do it, not wanting to have to do that as well. So since we cover those things, what happens? Well, what resources do you know of or can you offer through your comprehensive cancer center? Now I've been diagnosed with breast cancer. What now? Like, what are those next steps?
Right, so we have a patient navigation program. Again, our patient navigators work with patients on an individual basis. We will work with them through financial counseling. If they qualify for the breast and cervical cancer program, that's the best resource we have. If they do not qualify, there are other programs that we connect them to. So there's a group called Pink Ribbon Good. They focus on women's cancers. They will provide transportation. They will provide meals. They provide cleaning goods for women. So they have a lightweight vacuum that they will send you, things that you don't think about, right? Like, and then we also can work with pharmaceutical companies. So if the patient can't pay for the cost of the drug, the pharmaceutical companies sometimes have programs that will cover that cost for the patient. But again, if you're diagnosed with cancer, you're not going to have time to look those resources up or apply for those things. For breast cancer in particular, the Susan G. Komen Foundation has a treatment fund. So again, for women who, even if they have insurance and have a high deductible or copay, there are resources for that. But again, the common person is not aware for that. So we have navigators that will connect to the outside resources. We have some internal resources. We get people from all over. So sometimes we can provide transportation assistance, either through a gas card or sometimes people have to stay here. So we have a hotel program. And then we work with Hope Hollow that if people have to stay here, we can provide them a place to stay. Because again, a lot of people come here from all over the state. And then we also have some other internal programs and resources through our patient services. And then last resort, always, we can use charity care or HCAP. So the navigators will help the patients fill that paperwork out so that they can get a portion or all of their care written off again through that charity care program. And a lot of people aren't aware of that. And then, like I said, if there is a bill left over, we can also help them work to get on a payment plan. But the bottom line is we want people to get care and we don't want costs to be a burden.
That's great to know. We would definitely put those resources on our Facebook page, and they will be linked to our YouTube alongside with your OSU patient navigator phone number. That way we can, get the word to spread out in the community. And I do want to, again, just remind everyone about, inequities in breast cancer outcomes are unacceptable, hence why these programs exist. And we can expand this conversation to whether you're female identifying, male identifying individual, everyone should go out there and get screened, know your risks. It is also known that, for example, in the LGBTQ community, lesbian and bisexual women get fewer breast cancer screenings due to fear of discrimination, having negative experiences with healthcare providers, etc. So this isn't just a women issue, this is an everyone issue, hence why this is so important.
So I didn't bring it up today, but we do have, we worked with our breast center to be very inclusive in the language that they use. So a lot of their materials now say breast chest screening. It is an area that needs to be researched because there really aren't any true cancer screening guidelines for that community. There are some, but again, it's an area that we need to do more research for. There's guidelines around if you've had so much estrogen replacement and other things as you transition, what those guidelines will be. But again, we are very aware of that. We've done some sensitivity training with our breast center staff. So again, if individuals come in to the breast center, we're hoping that they will have a positive experience. And again, more research, always.
Well, I do want to just say a few things just to close this conversation out that we know you covered, 1 in 8 women will be diagnosed with breast cancer in her lifetime. That's 1 person every 2 minutes in the United States, which is just an incredible number. The 2 most common risk factors of breast cancer are being born female and getting older. And know your risk. Knowing your family history is life-saving. Talk to a doctor about your family history and see how that history impacts your risk of breast cancer. You and your doctor are the ones who can create a personalized plan to monitor for signs of the disease, which is really important. get screened. For those at average risk, have a mammogram every year starting at 40. If you have signs of breast cancer, finding early and treating it may save your life. There is a piece here that I do want to maybe touch on a little bit. What can you tell us about metastatic breast cancer?
Right, so that's what we don't want. And so that would be the stage 4, right? So where it's spread outside of the breast, probably in some of your lymph nodes. So again, that is something we want to avoid, because at that point you're treating more than just that breast chest area. It's in the bloodstream. So again, with metastatic breast cancer, we do have some advanced treatments. Women are living longer with metastatic breast cancer. So we have had some breakthroughs through clinical trials and research. Again, just not the best outcomes with that. Again, we've come a long way, but we want to try to avoid that. And like I said before, a lot of the times the first places that metastatic breast cancer will go will be the lungs or the bone. So a lot of women will maybe not go to the doctor, not have follow-up, and then they'll have a bone that breaks and they go in and find out, oh, you have breast cancer and it's spread to your bones, right? So we definitely don't want to do that. We want to try to catch it early, again, in that stage 1 or stage 2, where we can have better success with the treatment outcomes, and then less, again, comorbidities or complications from the treatment, so that the woman will have a better quality of life. But again, definitely have made some advancements. We have a lot of women who live about 5 years with metastatic breast cancer, some even longer, thanks to, again, clinical trials and research and new treatments that are available for that disease. And there's a lot of support groups and information online that are specific for women who have that type of cancer. Susan G. Komen has some of those resources. We have a James Care for Life program that has some resources for that. And we also have a high-risk clinic, so I probably should mention that. So if you do find out through a risk assessment or talking with your doctor that you are high risk for breast cancer, we do have a specialized clinic here that women can go to and get resources and work with some of our breast team and oncologists here that will follow them at the Stephanie Spielman.
That's great to know. Also know you're normal. It's important to know what's normal for you so you can talk with your healthcare provider if something doesn't look or feel right. I will share my own experience. A couple of years ago, I found something that I didn't think was normal, and I went to, the Stephanie Spielman Center, breast cancer. That's where my provider sent me. Had a mammogram, had all of that. They did tell me that I had dense, tissue. So, I had to be more on top of that. But, thankfully everything was normal. There was nothing wrong. But, I was 33 years old. So at some point I thought I shouldn't really worry about this. I'm so young. This is, it'll pass, it'll go away. And in a conversation with my provider was that she mentioned, you should probably get this checked out. It might not be anything, but just because you're not at age of risk doesn't mean that you're not at risk, right?
Right. We're finding more and more younger breast cancers. And again, in Hispanic, Latino women and African-American women, we do tend to get diagnosed earlier. I believe one of the oncologists I worked with said their youngest patient was actually a 19-year-old female that they've worked with. So it does happen. Again, it's mostly in older women, mostly after the age of 40, but we are starting to see younger cases of breast cancer that are diagnosed. So that we always tell women to advocate for yourself. If your doctor says it's nothing, but you feel like it is, you can always get a second opinion. It doesn't, like you said, it doesn't hurt to get it checked out. If it is nothing, then you have that peace of mind of knowing that.
Yeah, definitely. So going back to those points, right? Make healthy lifestyle choices. Living a healthy lifestyle is within your control and may lower your risk of breast cancer. Trying to maintain a healthy weight, sometimes not be easier. Limit alcohol intake, exercise regularly, not smoking. All these things matter when it comes to your overall health and risk of disease. So definitely at least try to make those choices if you're able to. I understand when it comes to inequities.
Right.
Maybe, having a healthy, food options for you might not always be available for you, but there are resources in the community who can help you with that as well.
And we do a lot of that. We connect people to food pantries. We do a lot with some of those groups. But again, there's also healthy alternatives, right? So fresh fruits and vegetables are sometimes very expensive, but if it's in season, there's a lot of farmers markets and places you can go to get that. But you can also do frozen, and if you have to, can just kind of wash the salt off, right? Like make sure you rinse rinse those canned vegetables. But so there are ways to kind of help with those costs. But you're right, and everybody can't join a gym. So we know there's some inequities again around where people live and the ability to maybe walk in their neighborhoods or safety or to do some of those outdoor activities. And then in Ohio, we have a lot of, not as much lately, we'll knock on wood for that, but winter. So we maybe can't get outside and do those physical activities, but we do some education around that, how to do healthier lifestyle things that are, not costly, things that you can do that are still going to impact your health.
Right. Well, to wrap it up, in case you need help or want to learn more about the page on breast cancer, can you give us some information again as to where to contact you, what number to call? I personally took the risk assessment test yesterday, and I can recommend everyone enough to do that, take that survey, take that assessment. But yeah, so you can call me directly at 614-293-2901, and I can answer any questions about not just breast cancer, but other programs that we may have. Again, for our patient navigator, if you want connected to a patient navigator, you can contact Viviana Bishop. Her number is 614-293-7020. She also is bilingual, so if we have some folks that need bilingual resources, she can also communicate to those individuals in Spanish. But again, either one of us can get you in contact with other programs, other resources, but those would be the best two places. And then again, the endbreastcancerohio.org is the Turning the Page on Breast Cancer website. For anyone that is interested, we do have that in our Facebook Live right now, and it will be in the comments on our YouTube once this is uploaded. Just want to thank you, Chasity, for taking the time to come in yesterday here in general session and being present and live with us, for providing us a lot of information and a lot of data and facts around it, especially in regards to health inequity. That is something that we take very seriously here at the Franklin County Board of Commissioners, and one of our driving forces behind wanting to, we want to eliminate poverty, because that's one of the main issues that drives all of this, right? You mentioned yesterday redlining and racism as a public health crisis that just kind of drives these numbers in health inequity, especially for, Hispanic, Latino, and Black, and then, African American women. So definitely want to keep that in mind. But yeah, thank you again for coming here, providing us with all this information. And I look forward to seeing any way in which we can collaborate to end health inequities regarding breast cancer.
Thank you. And yes, looking forward to working with you guys even more.
Perfect. Thank you, everyone.